I'm Dr. Sridhar. I'm a consultant neonatologist and currently I work at Alain Mediclinic. So one of the important things that keep changing in newborn babies is the stool pattern. Obviously, each baby has a different stool pattern. In the first 2 to 3 days, the baby passes a very thick green-black stool. It's called meconium, and it's dark green because of the bile that is in the intestinal contents that accumulates during the stage the baby is in the stomach of the mother. And when the baby passes the meconium after 2-3 days, the stool starts changing color. So you can see the transitional changes. So you can see the dark stool lightening green. As the milk starts coming, the stool lightens more, and you get the mustard color, the yellow mustardy seedy stools in the breastfeeding babies. Again, as the milk volume is increasing, you start getting frothing and watering. I explained the physiologic lactose intolerance earlier. So this is important for you to understand that physiologic lactose intolerance is normal. When the milk starts coming, the baby starts showing these symptoms. But again, at this stage, you know the milk is coming, the weight has increased, the jaundice is stable. So you can start waiting longer between feeds. You have already established lactation, so you can allow the baby to sleep longer if the baby is sleeping. Don't try to wake up the baby every 2 hours. Again, if the stool pattern becomes greenish but it doesn't change to yellow, it's still normal. A green stool is normal, and little mucus coming in the stool is normal. Breastfeeding babies have a very variable stool pattern. Once they start digesting the milk well, once their lactase enzyme has reached a good level, they may not pass stools for 3 to 5 days. So this typically happens after 10 to 14 days, usually in the 3rd week onwards, and it can continue till you start weaning the baby. So the baby may pass stools every 3 to 7 days, is absolutely normal. The tummy is soft, and when the baby passes stool, it's always soft. So this pattern is very normal for a breastfeeding baby, and you don't need to give a suppository. Of course, make sure that the thyroid is normal. It's part of the newborn screening. And once you know the newborn screening is normal, there is no need to worry about it. In a mixed feeding baby, if the stool starts getting hard, that means that you need to try and increase the proportion of breast milk, because breast milk is a natural laxative as well. And if you are on formula feed, sometimes we may consider giving prune juice or water to soften the stools if the stool becomes hard. I have some blogs on these topics, so again I can share the link if you need. Drop a comment on any of the videos.